The Cancer Drugs Fund was set up in 2010 to allow patients to have access to innovative medicines at the point of discovery. And it's been hugely successful to improve outcomes for patients in the UK, and over 76,000 patients have benefited from this fund. And this has enabled the UK to go up in the ranking in Europe from 10th place to 7th place in terms of access to cancer medicines.
The delistings that are happening currently are because there is such a huge clinical and patient-led demand for these medicines, and because they're so effective, we've found that the demand has outstripped the budget very quickly. So NHS England are now finding that there's a projected overspend of around £40 million for this year. We're having discussions with NHS England. We want to try and help them maintain the fund and to keep within budget, and those discussions are ongoing. We're still at the table with them. Nothing has actually changed in terms of the effectiveness or our knowledge about these medicines. The only thing that has changed is demand has gotten higher, patients and clinicians are using more of the medicines, and the budget has run out.
The decision means that up to 10,000 new patients will no longer have access which are currently available on the Cancer Drugs Fund come November. Fortunately, patients who are currently being treated or start their treatment up until November will continue to have access to these medicines. The Cancer Drugs Fund has run out of money and was never intended to be a long-term solution for how we provide medicines to patients in England. And that's why today we're calling for reform to make sure that for patients we can find a sustainable, pragmatic and flexible way to find access to these medicines.
As the world's largest investor in healthcare research and development and the largest manufacturer of cancer medicines, it's important that we can use our expertise and our knowledge and our innovation to help fix the system, to make sure that all these innovative medicines that we're bringing forward in the coming years can actually get to patients. Innovation isn't going to stop. We alone have got 30 new drugs in our pipeline that we want to bring to patients, and unless the system's fixed, we won't be able to do that, and the patients will never see the benefit. This isn't the end of the road. We're continuing to talk with NHS England. We're trying to come up with a mutually acceptable solution, which is going to mean that patients can continue to access our drugs. It's really important that we don't walk away from these groups of patients.